most crucial consideration for determining the ultimate outcome of LVAD support is the proper selection of patients for device implantation. In general, patients who are selected to receive an LVAD have end-stage heart disease without irreversible end organ injury. Although hemodynamic criteria remain important in deciding when patients should receive an LVAD, they should not be the only determining factors for device placement. It is also important to consider each patient's clinical history.
The ideal candidate is someone who is perfectly healthy, nutritionally, and is active, and has great heart function. But there are no patients like that getting pumps, so we deal with patients who have varying degrees of heart failure. And unfortunately, in the erstwhile phases of these trials and what we've been through to this point, the patients that come to surgery for heart pump implantation are quite ill, and hopefully in the future they will be less ill. We try to assess patients' nutritional status so that we can have a cohesive strategy for managing them after surgery, so we don't actually create a liability when we're trying to supplement them nutritionally after the surgery. Most of these people are compromised in that regard. When we see patients that have lost lean body mass, as an example, recovering them is an extra challenge. When we see older patients, their recuperative capacities are less, and down the line from that, even their performance abilities in terms of their neuromuscular capabilities, cognitive function, and dexterity, those things are diminished. So it impairs their ability to really live in concert with their pump without extra help.
Ongoing clinical evidence suggests that earlier deployment of mechanical circulatory support improves patient survival. Delaying LVAD insertion until just prior to death may significantly diminish the life-saving potential of the procedure, while LVAD insertion too early in the course of heart failure may deprive a patient of an additional period of technology-free life. An ideally timed LVAD implantation should occur late enough in the disease to offer the patient every possible opportunity for medical stabilization or recovery, yet early enough to give the implantation procedure a reasonable chance of success.
The point at which an LVAD should be implemented in order to achieve a successful postoperative course is really a matter of timing. Making sure that you're implementing this therapy when you know you have need of it, but yet well before you have allowed sufficient injury to occur that you've compromised your ability to succeed.
The recent REMATCH trial, randomized evaluation of mechanical assistance for the treatment of congestive heart failure, demonstrated that HeartMate LVAD support for destination therapy improved survival and quality of life for LVAD patients in comparison to patients who were optimally medically managed. Patients selected for LVAD implantation as destination therapy are those with New York Heart Association Class 4 symptoms from left ventricular dysfunction that persist despite optimal medical therapy. In summary, the decision to implant an LVAD requires the judgment of a qualified medical team and a well-prepared patient.